Let's now begin with the sixth mini module, implementing administrative controls. Administrative controls are essential for the success of IPC strategies. At the end of this session, you will be able to describe administrative measures, explain the composition and responsibilities of Infection Prevention and Control or IPC committee, and explain the roles and responsibilities of IPC team and monitoring team. Among the various strategies adopted by the Bangladesh government to prevent and control COVID-19, it has made the formation of Infection Prevention Control or IPC committees in all designated COVID-19 hospitals mandatory to facilitate the implementation of IPC measures. The operational manual to run a COVID-19 hospital is applicable for all designated COVID-19 hospitals in Bangladesh. All COVID-19 hospitals need to have IPC committees who will supervise the IPC activities. Administrative measures following WHO guideline must be implemented in all facilities. A number of administrative measures are defined for health workers as well as visitors. The administrative measures include provision of developing and supervising the implementation of facility, IPC policies and guidelines, adequate training for health workers, and also maintaining an adequate patient to staff ratio. The measures also emphasize on the need to establish an active syndromic surveillance of health workers at the facility entrance when they arrive at work. Ensure that health workers and the public understand the importance of seeking medical care promptly. Monitoring health workers' compliance with standard precautions and providing mechanisms for improvement as needed. For managing visitors, a number of measures have been emphasized with an aim to keep the infection under control. Some of the measures are to identify alternatives for direct interaction between patients, family members, other visitors, and clinical staff, including making remote communications available, for example, telephone, internet connection, etc. Restrict entry to visitors who are essential, such as the parents of pediatric patients and caregivers. Encourage family members to assign a single caregiver to the patient. These caregivers should not be people who are at high risk of severe COVID-19, such as older people or people with underlying medical conditions. Designate an entrance that visitors who are caregivers can also use to access the healthcare facility. Maintain a record for all visitors allowed in the facility. Educate caregiver visitors on hand hygiene, respiratory etiquette, physical distancing, and other standard precautions and how to recognize the signs and symptoms of COVID-19. Let us look at some more measures to be followed by the caregivers as well as the hospital or the healthcare center. Some of the measures include train and supervise caregiver visitors of patients with suspected or confirmed COVID-19 patients on the use of required PPE, that is, droplet and contact precaution. Caregiver visitors in areas with community transmission, including those caring for patients without suspected or confirmed COVID-19, should wear a medical mask in clinical areas to prevent transmission. Restrict movement of the visitor within the healthcare facility. Conduct active screening of all caregiver visitors before entering the facility in areas with widespread community transmission. Prohibit visitors' presence during aerosol generating procedures. And reduce traffic to the healthcare facility, consider relocating outpatient pharmacy or other services to a location outside of the main healthcare facility. As per the guidelines, IPC committee should be formed in every healthcare setting. In the medical college hospital, the committee will have a chairperson, a co-chairperson, a member secretary, members, and a focal person or a coordinator. The director, medical college hospital, is appointed as the chairperson. The principal, medical college, is appointed as the co-chairperson. Department head or associate professor or assistant professor of microbiology or virology department or deputy director, assistant director, resident physician or resident surgeon is appointed as the member secretary. Members can be one professor from each department, nursing superintendent or ward master. A microbiologist, a virologist, or an assistant professor is the focal person or a coordinator. The IPC committee in a specialized hospital will also have a chairperson, a co-chairperson, a member secretary, members, and a focal person or a coordinator. The director, specialized hospital, is appointed as the chairperson. The deputy director is appointed as the co-chairperson. Department head or associate professor or assistant professor of microbiology or virology department or deputy director, assistant director, resident physician or resident surgeon is appointed as a member secretary. Members can be one professor from each department, nursing superintendent or ward master. A microbiologist, a virologist, or an assistant professor is a focal person or a coordinator. In a district hospital, the IPC committee includes a chairperson, member secretary, and members. The hospital superintendent is appointed as the chairperson. The resident medical officer or RMO is appointed as the member secretary. Members can be a one consultant from each department, nursing superintendent or Martin, or a ward master. The IPC committee of the Upazila Health Complex includes a chairperson, member secretary, and members. The Upazila and Family Planning Officer (HFPO) are appointed as the chairpersons. The Resident Medical Officer or RMO is appointed as a member secretary. Members can be a one consultant from each department, nursing superintendent or a Martin or a ward master. The IPC committee has various responsibilities to ensure infection prevention and control. These include developing an IPC work plan and implementing it within the hospital, introducing infection register and establishing infection surveillance regularly, to review data and take necessary measures, coordinating and conducting training activities including staff training. The IPC committee also has to implement measures such as providing or advocating for sufficient resources to support the IPC program, monitoring infection prevention practices and applying measures to close gaps between set standards and actual practices, for example, hand hygiene, appropriate use of PPE, isolation, sterilization of equipment, waste management, etc. Collecting data to measure indicators reflecting extent of infections acquired. The IPC committee ensures health facility, for example, COVID infection rate among the hospital staff, post-operative infection rate, developing and disseminating infection control policies for the hospital. The committee will meet together once every month to review the IPC situation of the hospital and take necessary actions. The member secretary will arrange the monthly IPC committee meeting. There will be one or more IPC teams in a hospital or in a health complex. The team will work dedicatedly for the hospital and the team will be formed with medical officer, a facilitator from the existing work improvement team, and senior nurse staff, a member from existing work improvement team. The responsibility of the IPC team is multifaceted. The IPC team at different sections of the hospital will implement the action plan as developed by the IPC committee. The teams will coordinate with the IPC committee for necessary logistic and technical supports as and when required. The team will introduce the infection register in the section and record all the information. Monitor and report the progress of implementation of the action plan and the IPC situation of the section to the IPC committee periodically. Meet every week or fortnightly to discuss the IPC situation of the section and take necessary measures to improve the situation. There will be a monitoring team in every district to monitor the IPC status of the hospitals and provide necessary advice. The team formation can vary from district to district. The IPC monitoring teams of the districts where there are government medical colleges will be formed with the president, members, and member secretary. Professor or associate professor or assistant professor of microbiology or virology department will be the president. Associate professor or assistant professor or consultant medicine will be a member. Associate professor or assistant professor or consultant from anesthesiology department will also be a member. Deputy civil surgeon or medical officer or civil surgeon or civil surgeon designated officer will be the member secretary. In districts where there is no government medical college, The IPC monitoring team will be formed with the president, member, and member secretary. The medicine consultant will be the president. The anesthesiologist will be a member. The deputy civil surgeon or medical officer civil surgeon or civil surgeon designated officer will be the member secretary. The IPC monitoring teams have various roles to play. Some of them include inspecting all government and private hospitals, health institutions, and clinics in the district for prevention and control activities. During the outbreak of COVID-19, they will conduct monitoring activities in the hospital where the patients are treated, visiting the COVID dedicated hospital at least once a month, conducting monitoring activities in hospitals as per national IPC guidelines. The other roles include monitoring checklists sent by the Department of Health, providing advice on improving hospital infection prevention and control activities, meeting with the Hospital Infection Prevention and Control Committee and provide necessary guidance, sending their report through the civil surgeon to the disease control branch of the Department of Health on a regular basis within 3 working days of monitoring. This brings us to the end of this mini module, implementing administrative controls. In this session, you have learnt about administrative measures to be implemented in hospitals of Bangladesh, the structure of IPC committees, and the roles and responsibilities of IPC team and IPC monitoring team. You may now attempt the ungraded knowledge checks for this session.